And a little bit of information about us. We are Shared Action HD. We are funded by the Centers for Disease Control and Prevention to provide free trainings and one-on-one technical assistance for health departments on evidence-based interventions and public health strategies, monitoring and evaluation, and organizational infrastructure and program sustainability. We would just like to acknowledge AIDS Project Los Angeles, the Center for HIV Identification, Prevention, Treatment Services at UCLA, and the Centers for Disease Control and Prevention. A little bit about our presenters today. Juan A. Mendez has an MA and is the DIS Program Coordinator at the Multnomah County Health Department. Previous to his 17 years in Multnomah County, Juan was a CDC public health advisor in New York and a public health associate in Los Angeles. He has devoted the last 21 years working in public health with STD and HIV programs. Along with him is Edwin Diaz, who has a bachelor's degree in science. He has been working in Multnomah County Health Department for the last 12 years. Out of those 12 years, 9 years have been devoted to working as a disease intervention specialist. And without further ado, Juan Mendez can start the presentation. Thank you.
Hi, and thank you for inviting us to do this presentation. And Kim Taves, our program manager, is also here. I'll have everyone introduce themselves very quickly. The other option we'd like to offer is if you have any pressing questions, you can feel free to text us at 503-334-1804. We're using a Google Voice app on iPad, and that's worked very well for us with previous presentations. So I'll have the rest of the staff introduce themselves.
Hi, everybody. Hi, everyone. I'm Edwin Diaz. Thanks for being here with us, and hopefully we'll be great of help in terms of providing tools and suggestions to do awesome public health care.
And hello, I'm Kim Taves. Thank you very much for your presence today.
So, Edwin? So, again, with Multnomah County Health Department.
Yes, well, with Multnomah County Health Department, we serve pretty much the Portland metro area. It's roughly between around 2 million people. There are 5 DIS that work at Multnomah County Health Department. In 2011, we had a caseload of 100 gonorrhea cases, 124 HIV cases, and 128 early syphilis cases. To some of you who have never been in Portland, Portland is called the Rose City. It's a great city to live in. The show Portlandia is filmed in its location here, so is Show Grimm. If to some of you who like sci-fi and have time to watch TV at night, check it out on NBC on Monday nights at 10.
So we've gone through a transition over the years. When I first started as a public health associate in Los Angeles, basically this was the next to last training class they had for public health associates. At the Figueroa Street Clinic, all we had was filing cabinets and some old phones, and that was it. That's how we tracked everything we did. That's how we monitored and did all our work on. Over the years, we've seen some changes with email gaining popularity. For a while, we thought that texting programs such as Microsoft Messenger, AOL Messenger were really going to take off, and at one time, all of us in our program had all diverse amount of texting programs installed in case we wanted to use it. And this was before the National Online Partner Notification Guidelines came out. And then we saw the transition to people using email and people using InSpot a little bit, and then more and more people saying, hey, I met my partners online, and we developed since 2007, we started using online partner notification with Manhunt, who was a big player back then, and over the years this has changed to the point now where Atom for Atom is a big player. But as that went on, we saw more and more that people were using technology, and I would go on the bus, go on the train, and every day I would see people with their phones texting away, and then the move to smartphones, and they would be texting away. So we got into using smartphones for texting as a program. and we'll talk about that in a little bit. And then now, in the last 6 months, we've been using, last 3 months, we've been using Google Voice because we wanted to get away from the use of smartphones because of the cost of smartphones and use a free program such as Google Voice. So we're just going to talk a little bit about how we've done so far since we went live with using texting in January of 2011 to 3 months ago when we transitioned to Google Voice. So obviously texting has seen a huge explosion, especially when it moved away from where you paid for each text message, even though we do have people in the program that still pay for each text message, and they have a heart attack if you send them a text message. But now most people have all-you-can-eat plans where people just, they text unlimited as much as they want. Edwin's child, for example, is one of the great users of texting. He probably does 200 text messages before lunchtime.
Oh, the thing is, anyone who has teenage children who are in the teenage age and up, they know now teenagers don't answer calls. You text them and they will text you back, or they get back at you. So that's a reality or how we live nowadays.
And I went to Sex Tech for a couple times, and one time Brandeis University did a presentation on how they were using Google Voice for when they did presentations that people could text their questions and stuff. And I was thinking, that's a good idea. And that was one of the things that got us motivated, really motivated, to using texting for phones and now to using Google Voice for phones.
We were, the Multnomah County management staff and HIPAA officers, health officers, we were in a procedure of using SMS, short message services, AKA texting, as a tool to try to locate or either original patients or do partner notification services. So finally, the procedures were completed in June 2010. So what did help us achieve that goal? Well, we had already been doing online partner notification, so it was an easy transition because we just sort of mimic the system that we had. And to those of you who might not be familiar with online partner notification, also all of us who are involved in disease intervention strategies and disease intervention services know that a lot of our patients, they meet anonymous partners or partners online using social websites such as Adam for Adam, Manhunt.com, Gay.com, Gruff, Grindr, and so on. So we already had a system in place, and we had an established track record of providing confidential services via email, right? So the HIPAA officer in Multnomah County wrote a procedure of which a large part taken from our original draft on online partner notification services. The HIPAA officer and the health officer have been a great advocates of our efforts, and thanks to them, and thanks to our previous success, it made it very smooth to actually achieve texting as a tool. The procedures do not require opt-in when used for partner notification services, and procedures do require opt-in when providers, if they want to use that in terms of reminding patients about their appointments or follow-up appointments. The slide that we see now, if you could go back for a little bit, those are the 3 canned messages that we use when we're trying to locate someone about original patient. And if you notice, it goes to the point, but it's very vague. Vague is not the word. Don't necessarily. It protects clients' confidentiality. You just have 3 examples right there.
So the same 3 messages that we developed for using iPhone, we were using iPhones to do texting since January of 2011, are the same 3 messages that we transitioned over to using Google Voice. Yes, a tease, something to get the client, to motivate them to call us so we can have the DIS conversation with the client.
And this is Kim. I just wanted to say that these are the same messages we came up with originally for email or for messaging people through the web-based sites. And our very first attempt was a lot more informal and loose, where each of the DIS knew the general framework of guidelines of what to talk about or not talk about through email, but we're really recreating emails afresh for each client and having a more informal approach. And what we became aware of is that unlike a phone conversation, whatever you're saying in email or in any kind of writing is preserved forever potentially. So any of the typos you have are preserved. Any of the differences or variations between different staff in terms of tone, in terms of how much content you share. And so even though normally the texting, the instant messaging are all thought of as rather informal communication styles, and this may not seem to match that culture with the formality of the language used, we did end up deciding to use something really standardized just so that we could get our procedures approved and that we wouldn't have any problems later on with people sort of stepping a little bit too far out of what kind of content we want to discuss online.
And that leads us to the golden rules of both texting using phones and texting using Google Voice. You have to understand that text messages are not secure. They're subject to public records retention laws. In other words, we have to keep whatever text messages we send, we have to keep copies of them. And for DIS work, in other words, you make a phone call first. If that doesn't work, when we first started off with text messaging, we said, okay, with the DIS, make a phone call, and then if that doesn't work, you do your mail out. If that doesn't work, you do your field visit, and then worst case scenario, you send a text message. After about a couple of days, we said, this is insane, because people were responding to the text messages so fast, so we actually rewrote the procedure so that you make a phone call. If you don't get no response, you send a text message. And the fact is, 65% of the people that we text immediately after a phone call us back off of the text message. It's just amazing.
You're going to see those results in the next few slides, how amazing texting is.
So again, the purpose of sending a text message is to engage the individual in a voice-to-voice or face-to-face conversation. Basically what you want to do is just tease them into calling you, and then you can have your regular DIS conversation. You never want to reveal or send protected health information via text message. That's why it's so important for a program to say, these are the 3 CAN messages we're going to use. There's no deviation about it. That way it's impossible to get into the mistake of sending public health information. You just use the 3 CAN messages, and it's going to increase your productivity just in using those 3 CAN messages. So we've seen since we went live with texting in January of 2011, and now we're going into August. During that time period, we've had 2,065 cases of gonorrhea, HIV, and early syphilis. We've texted about 497 of them, or 24% of them. So typically when someone tests positive, if we've done a presumptive interview, or we interview in the clinic, or we make a phone call and they answer the phone. But for those people that don't fit in that requirement, then we text them. And we have a 24% will text, 64% response rate. That means you don't have to do mail-outs, you don't have to do field visits, you don't have to do additional phone calls. The people will respond to your text messages. And then we wanted to measure and see the difference, whether there was a difference by gender. So basically, since January 2011, we've texted male 1,558, female 498. The fact we're only documenting efforts for original patients. We are texting chlamydia cases, we are texting partners, but for purposes of this study, we're only documenting our efforts versus the OP or the original patient. So the numbers seem a little low, but we're actually texting a lot more than this.
And we're getting more response than we're actually capturing, by the way.
Exactly. So the response for male, we have about 65% response rate. For female, 61% response rate. And we feel at this point we have almost a year and a half worth of numbers, so that the numbers are pretty realistic. If
you guys see in this slide, this new slide, we divided. We want to measure not only by gender, but we want to measure the response based on the different diseases, right? So if you notice, we have 50,534 cases of gonorrhea, 231 cases for HIV, 300 cases for early syphilis. You see the great amount of response rate that we have had. We have between 64 to 68% out of those people that we actually had to text. And keep in mind, we text them if we don't receive if we either don't talk to them face to face, or when we call them we don't get a response. Then we test. So out of those that we test, we have a range between 64 and 68%. So that's way more than a half of the people that we text. Then we want to check the age demographics. We have between 1 to 20, 20 to 30, 31 to 4, 41 to 40. Just to let you know, the youngest patient that we had to text was 14 years old. But for purposes of our study, we had divided between 1 to 20. And people were saying, no, the young people will not text. They don't know you. You know what? We'll see right there that we have out of the 295 cases between the ages of 1 to 20, 24% of them we text them, and we had a 64% response. 62, I'm sorry. And actually we see across the board, and it was a very, especially in our age group between 31 to 40, we saw almost a 70% response rate. Not only that, we want to also, as a part of the study, we want to prove also that not only is by age, by gender, or by diseases, we want to see our race and ethnicity demographic groups. We have white Caucasian, African American, Hispanic. You can see on the screen 67. The lowest response rate 58%, and white Caucasian 67%, Hispanic 75% response rate. We also want to compare clients who identify themselves as men who have sex with men versus clients who identify themselves as non-MSM, and we see a great response, 55% with non-MSM, 72% response rate among MSM. And I remember more than a year ago, before we started even texting, but we were part of the process, I remember interviewing an original patient who identified themselves as men who have sex with men, and he was one of the person who said, actually, you know what, Edwin, you wanna reach our population, folks in the gay, I'm quoting him, folks in the gay community, we don't talk on the phone, we text, and that's a great proof right there.
So we wanted to compare January 1st to August the 23rd, how we're doing 2011 versus how we're doing this year. We've had a little bit more cases this year. We've texted a lot more people, from 19% to 29%. When we first started texting people, there were several objections for the DIS. In fact, someone who's sitting next to me, whose name I won't mention, was saying, well, my fingers are too fat, I can't text, or this is too hard, or cutting and paste using an iPhone is too hard. The fact is, we probably could have started texting earlier than January 2001, but we were waiting for the iPhone because we didn't want to use BlackBerries, which to me seemed like extremely hard to do. So we waited till the county approved the use of iPhones, and that's when we started texting and cutting and paste, which is takes a little bit of getting used to, but now with Google Voice, it's just so easy to do. So basically the numbers, people are used to texting. It's a natural process of the way we do business. Our business plan says you call, and then before you invest all that time in mail-outs and waiting for the mail-outs and doing field visits, you text the client because you're going to have a 65% response rate. And then one of the questions we had are there any numbers for Asian and Pacific Islanders? If not, where do they fall in your calculations? The population, the demographics in Multnomah County are mainly white, black, African American. There's a very low
Latino
and Latino, and there's a very low reports of Asian Americans. So we did not report that out. I think it was less than 20 over the 2-year period. So the numbers weren't significant enough for us to report it out. But we can get those to you if you want them. So we were happy using the iPhone. It worked really well. It's a major investment. We started off with 2 iPhones, one for 5 DIS. Certain people's name I won't mention would maybe bogart or claim the iPhone is theirs and not let anyone use it. But I'm not looking at Edward. But people really, after a while, people love the iPhone and love using it. So we had to make a decision as a program. Do we get everyone an iPhone? And if you have more than 5 DIS, if you have 10, 15 DIS, that's a significant cost. Or do we want to look at some other program or some other way of texting that reduces the cost barrier, reduces the entry barrier, and more important, simplifies the process? So again, I've been using personally Google Voice since 2010, and I really, really like it. So I really advocated for us to use Google Voice. So we had a choice. We could just create a Google Voice account, or we can go through the whole county process of getting approved to do a Google Voice account. So in Multnomah County, we do use Google as our main email client. So that was one huge plus. So it's just a matter of getting the Google Apps group to give us permission to do this project. What seems like a no-brainer actually took 4 or 5 months to get approved, and it was originally disapproved, and then we had to rationalize why we wanted it, and finally we got it approved. So we did get the Google Voice approved, and then we started live. Edwin was the first beta tester. We wanted to see what obstacles, what things he could see that would different from using an iPhone. So basically, we have some Google Voice tips. It's real important if you've ever used Google Voice, or a Google account, you have a task list. So one of the things we've said is let's put all the approved canned messages that we have, store them in a task list. So absolutely there's no way anyone can use other than the approved messages for sending text messages. And it's the same 3 messages that we had approved for doing traditional text messages. So why Google Voice? Well, we rely on texting for partner notification. If I QC a DIS record and I see that they made multiple phone calls and they didn't send a text message, I'm going to go talk to that DIS and say, hey, it doesn't make sense. You're just wasting time. If you made a phone call and they didn't respond, you need to automatically send a text message. So now it rarely happens that someone makes more than one attempt without. It used to be in the old days when I was at DIS, I would make a morning attempt and then an afternoon attempt, and then in the old days a late night attempt. Now you phone call and you text.
Texting now, when we have a case and you make your original phone call to the original patient and including the contact and they don't answer, we don't get a response. It has become in our program a second nature just to text immediately.
Exactly.
Texting is the next step. That's that without even thinking.
So here's a question. What are the expenses for Google Voice? Right now, Google Voice is free. It's 0 expense. It reduces the burden for health departments that don't have any money. For small health departments where investing in one iPhone is a major expense, so it reduces the burden to 0. You just create the Google. You want to get your approvals because every state and every county and every health jurisdiction has restrictions that they place on health departments. So in our case, we wanted to get approval, but once we got the approval, we created the Google email account. Part of the Google email account includes Google Voice, and it's absolutely free. Unless you're making phone calls or long-distance calling, sending text via Google Voice is absolutely free.
I'll add a comment, which is that our county has been really aware of some of the national trends politically to scrutinize the benefits that public government employees get, whether they're salaries or other benefits. And that's led our county to scrutinize carefully how many iPhones are distributed among our staff, to what purposes are they being used, how many minutes And so we're in a little bit of an environment where there was also a little bit of a political benefit to us to not have many, many iPhones floating about.
So we gave back our 2 iPhones and got a GPS unit, and we're absolutely only using Google Voice. So the iPhone's expense was about $50 a month, but if you multiply that over the amount of DIS that you have, that can add up. So we're going to talk about in a little bit about Google Voice and how you can use it. You don't necessarily need 1 Google Voice account per person. We're using 1 Google Voice account for 7 people for our team. So if you're in Los Angeles and you have a team of 5 DIS in one location and another team of 5, you just need 1 Google Voice account per team. And we'll go on to the next one. So the iPhones, and this is partly to answer your question, the iPhones were costly. Cell phone texting may lead to repetitive motion injuries such as carpal tunnel syndrome. And this was our informatics manager who put all this in doing the rationale for why we wanted to use Google Voice with a keyboard versus using iPhones. And sending a large number of texts via cell phone is inefficient and time-consuming versus it takes about 10 seconds to cut and paste. And once you cut and paste a Google Voice, your canned message once, you use it for the rest of the day. You just change the patient's name and the phone number, and that's it. Paste it, and you're done. And so the goal of the beta test was to reduce the texting costs. We got that down from where we were paying for 2 phones. We were paying about $120 a month. We were going to go to 5 phones. We really didn't want to do it. To now we have 0 cost for texting. Very easy for the staff to use and increase texting business practice. I mean, you can do it in 5 or 10 seconds. So Google Voice tip, each DIS, and this is huge, each DIS team can use 1 Google Voice account. And that works really well for our team because if someone else from the team notices if someone texts back, then they'll just say, hey, Edwin, someone just texts you back, and so it works really well.
The thing with Google Voice is not only is a 0 cost tool, and you do, you text the patient. If you have the canned messages, and you cut and paste. All you need to do is change the first name, like Juan says, of the patient, and the number that you're gonna text. Send it. You have that on your screen, right? So let's say you're talking, you're going somewhere, you get off, you move away from your desk for a little bit, and Juan is working on his desk, and he has it open. He can see someone text me because you can actually also you can see all the texts that have been sent on ever because we don't erase texts that are sent through Google Voice. So it's amazing.
And keep in mind that when you set up a Google Voice account, you log on, you get approvals. And I can't emphasize that. You get approvals from management, and then you create a Google Voice account with a reasonable-sounding username, even though no one will probably see your username. And then you create a Google Mail account, and then you activate Google Voice, and then it's going to assign you a local telephone number. And then what you do, the first thing you do is you call forward that number to your hello line. DIS, for example, every DIS place that I've been to, every STD program, you always have 2 phones, 1 phone for official business and 1 phone is a hello line where clients call because you text them or you email them and this is the number they call. So the first thing you do is you forward your Google Voice assigned number to your voicemail account. That way if anyone calls that number that you're using for Google Voice, it'll go automatically to your hello line. It works elegant, really well. So each team, we recommend that each team get a Google Voice account. You don't need a Google Voice for every person. And the great thing about Google Voice is also you can add notes. For example, if Edwin can log on to his Google Voice and the text that he sent, and if the guy texts back or something happened, I could always add a note to that just to give him some additional information. And so the Google Voice procedures, you absolutely positively have to have a great procedure written up on how you're going to do this, who can do it, what messages you can do. So texts are an effective method for contacting individuals. that are difficult to reach and do not respond to phone calls. And it's really important to have use this to prepare a canned stairway speech, because you're going to have a lot of obstacles from management, especially if management is really not techie and doesn't understand how this works. And the key thing you want to tell management is you will never send protected health information. You will only agree to use specific canned messages, and that's going to open up a lot of doors.
And I can stress this enough that the main goal of the texting that you're sending is so you can engage with that particular individual, or either in a voice call conversation or in a face-to-face interaction. You know what I mean? You don't want to have a whole texting conversation with that particular person. You want to avoid that. You want to be your main goal is to motivate that person to call you or to show up at, in our case here in our clinic where we're based at.
So another Google Voice tip is, and we already talked about this, is using your canned messages. Have them as part of your task list. Zero deviation. Especially at the start, where everybody's new and getting used to using it, zero deviation from the canned messages. You just use those 3 messages, and that's it. And the Google Voice procedures is, again, sending a text to engage. Edwin talked about this, engage the individual in a voice call or face-to-face conversation. We can use Google Voice to inform, and you want to absolutely clear this with your supervisors and get approval from the county health officers and the HIPAA officer. In Multnomah County, without a client opting in for DIS services, we can send them reminders. For example, you text them and say, hey, don't forget about your appointment. You absolutely cannot tell them what clinic you're calling from or anything, but you can send those reminders, but you absolutely have to get approval ahead of time for sending those type of things. And if I was starting a new texting program at a new program, I would kind of hold off on that until people felt comfortable using Google Voice with the canned messages. And then, for example, the DIS in Multnomah County also do EIS, the early intervention services. And so we're helping people get into care and stuff. So it works really powerful to send a message, hey, don't forget about your appointment for tomorrow or whatever the appointment is, especially if you have a guy who needs his 3rd injection of bicillin for syphilis and you're really worried because you don't want to start all over again. It makes sense to text him and say, hey, don't forget about your appointment with tomorrow. Yeah. So again, the procedure for texting clients with Google Voice, text carry the same risks as voicemails. Messages can be used by others, and you want to only use approved messages. Confirm that you're using the correct number before texting. Take your time. The first time people use it, they get a little nervous because it's new and it's a new technology, and we've had 1 or 2 cases where people text the wrong person. So have a procedure in place in case that happens, and you know what to do, and the key is informing your supervisor. Send all texts using Google Voice via your official account. Don't let people create their own accounts and start using it. All text must be documented. If you're going to start using Google Voice or texting as an iPhone and you want to measure the success of that program, make sure you develop some local use codes depending on what program you're using to measure the success of your texting program. Because what's going to happen is in Multnomah County, we started doing it, and then the CD, communicable disease nurses, started doing it.
One thing that one thing that we're talking about the canned messages. I'm just going to go back a little bit. That you wanna stick with them, but this, of course, we're dealing with human beings. We're dealing with different individuals. So we don't live in a perfect world, and you're gonna find that many times the patient, instead of calling you back, like those sweet numbers that they do respond. Some of them don't. So how do they respond back? They text you back, like, who the are you, and why are you trying to get a hold of me? There's you could go into the gray zone, and what I've done personally, I go, this is Edwin Diaz. I cannot disclose what I'm trying to get a hold of you because it's confidential. I want to protect your privacy. I encourage you to call me, I will be more than happy to explain to you why I'm texting you, and call me at these numbers. And that's it. You know what I mean? You never, and you try to persuade them to stay away from having a text conversation.
So again, clients must be informed to never send protected health information via text. Do not erase any text. It's hugely important. If you erase text, you're just opening up yourself to trouble later on. If you make a mistake or whatever, the best thing you can do is just let your manager know, hey, I messed up, I texted the wrong person, and then it's covered. We run it by the HIP officer and see if there's anything we need to do. Because you're not sending any protected health information in the first place, usually it's not even an issue. She'll say, okay, that's cool. And that's why you never want to send protected health information. And the other thing is be prepared to respond immediately. If you text someone and you know you're leaving for the next 2 hours to go to the field, go to a meeting or whatever, that's probably not the time to text that person. So Edwin talked a little bit about this. If the individual responds with a text, respond with another text asking them to call you. Be aware of the tone of your text. It's extremely difficult to discern tone in text messages. You want to remain professional at all times. Don't get mad at clients if they curse you out. We've had a guy that we sent a text message to that for about 90 days he texts us back every day cursing us out because we wouldn't tell him what was this about. And we responded a couple times and said, hey, just call us and we'll be glad to explain. But he didn't want to call us unless we told him via text. And every day for about 90 days he texted us.
And the thing is, I was the fortunate recipient of his text and his rant. So, that's the most extreme case that I've had. I texted the gentleman, tried to, call me so I could interview him. He tested positive for syphilis, and all of a sudden he went into a rant, and every day he would text me back, and I cannot even repeat the words that he used. But you never, he refused to call. You never engage in a text conversation.
And then develop your canned messages with the understanding that you have 160 characters. So we managed to fit it in nicely in that 100, because you don't really want to split. If you go over 160, you're going to split the message into two texts, and you don't really want to do that. Some people don't have text plans and may be charged and become sensitive if you text them because they're paying 24 cents a text or something, so you have to be respectful of that. The other thing is when you text people, if it's not a cell phone, you'll get a message back that says, hey, this is not a valid number, so you know it's not a cell phone, so there's no need to keep texting it. Just use the tradition. It's a traditional landline. Texting should cease once contact is made with the individual or as soon as the case investigation is completed. In Multnomah County, if the clinics can have clients opt in to receive text messages as a provider, because the providers are doing it anyway, texting kids and stuff to remind them stuff. But Multnomah County has an official policy that clients can opt in to receive text reminders. But for DIS work and DIS duties, we do not need an opt-in request. It's just approved that we can text people as part of our DIS work. And personal texting with clients is absolutely strictly prohibited. You just want to use the canned messages. And the great thing about Google Voice, if you're a manager, once in a while you can just go in and go through all the text messages and make sure they're all legit and no one is using them for personal business. And that absolutely has not happened in Multnomah County. So information you may include in a text message, the column on the left is yes, the column on the right is no. You can include your name, your county phone number, a statement that identifies you're from Multnomah County or Los Angeles County, a request for the client to call you in whatever language you want to use. We can, in Multnomah County, use client appointment time, no consent if for partner services, appointment location, no consent if for partner services, and missed appointment reminder, no consent for partner services. If I was starting new and this is the first time the team is going to be using Google Voice, I would limit it just to get messaging, get them to remind people to call you before I went into the appointment part. And what you cannot send is protected health information in a text message, information that identifies you as a health healthcare provider or a specialist or client referral information. So strictly speaking, you just want to use the 3 CAN messages. So examples of text that may be used: I'm Edwin Diaz with Multnomah County. I need to speak to you. Please call me as soon as possible, etc. So these are just some examples, whatever works best for your program. Many of these mimic the online partner notification emails that we use. Responding to a text message: if client responds to your text message with a text, use an approved message to encourage the client to call you. And Edwin talked about this already. Never, ever respond to a text from an individual that contains public health information. Instead, send a new text message to the individual to call you.
And those are the examples that those are the samples that you might want to use if someone, again, keep insisting and texting you back, and they're at that time refusing to have a phone call or a face-to-face interaction. You can do that. I'm not able to give you specific information in a text message, please call me, or I can tell you more about the call. If you call me at this number, this is urgent, I need your immediate attention. And if you notice, no public health information is stated or captured there. So, you're on a mission to do partner notification or original patient interview and doing great public health work, and at the same time protecting that person's privacy and confidentiality.
And that should be the party line whenever you talk to other managers, to other team members, to anyone, and you're trying to get people to agree to let you do this, is we never send protected health information via text. We only will use these 3 CAN messages, and then some minor deviation when you try to motivate someone who's asking questions. So documentation, you want to make a note in your case notes that you text the client. In Multnomah County, we use a local use code that tells whether you text the client and they didn't respond, whether you text the client and they responded, or whether you didn't text the client.
And that's very helpful, because you want to, once you start implementing texting as a tool, you want to measure it for a while. You want to see how what is working and what is not working.
And so whenever I QC cases and I'm looking through the notes, and I talked about this a little while ago, if I see multiple phone calls at a field visit before a text message, usually I'm going to have a heart attack or something, because it doesn't make sense to spend all that time going to the field and making numerous phone calls. If you haven't texted the client, if you know that 65% of them are going to call you right back. So the conclusions: we feel that texting can improve DIS outcomes. It should be part of any program, where now CD nurses in Multnomah County are also using texting. We know that 60+% of the clients that respond to a text message after a phone call, and using Google Voice, which is free, tremendously reduces barriers for small health departments or agencies that want to get people to their appointments. If you're a Cascade AIDS project in Multnomah County and you have a client that has an appointment for his initial intake, wouldn't it make, and you know that you have a 30% no-show rate at the HIV clinic, wouldn't it make sense to text that client the day before to remind them to come to their appointment? So it can have a huge payback at a real low or no cost. And just a couple citations, they'll be available in the PowerPoint. Additional information, feel free to email me or Edwin. And that's it. And we had one question. No, we already answered the question.
Well, thank you guys very much for giving the presentation. If anyone attending the presentation now has any other questions, please feel free to either text them to the number I listed in the chat, or you can just type them in the chat box and we'll get to them. I do have a couple of questions already from people from the audience. You mentioned that it took you 4 or 5 months to get approval for this. And outside of what you had mentioned, do you have any other tips or recommendations for us to help argue to implement Google Voice?
Well, it took us a year and a half or more to get the original texting permission, just to use phones for texting. So we're using texting very nicely. It's working good. We've been using it for a year. We had a letter to the editor published, so there's evidence that says that texting works. So we say, hey, let's use Google Voice, because we already have Google Voice. Google is our main email system. And we actually submitted it and saying, hey, we're already doing this. We want to just use Google Voice. 3 months later, it was declined. So we had to go back. So what seems obvious and simple is really complicated sometimes because of the layers of management that you have to go through. Example, we had to go through a Google Apps committee. We had to go through higher level management and convince them. And so you just have to be patient, and especially if you're the first one in the state who's trying to do this, or the first one in your county, you're going to have layers and layers of obstacles in front of you to get permissions. If you've been doing online partner notification and successfully doing it, then you have a huge card in your favor that you could say, hey, this pretty much mimics online partner notification. We're just moving it to the texting field. So, but be prepared to handle numerous obstacles in trying to get it approved.
It's not a road. It's an obstacle course. So you know, some of you guys might be fans of Greek tragedy and Greek hero quest. That's what it is. I'm not playing.
This is Kim. I just wanted to add that some of the challenges and delays we had with Google Voice were because we already are using Google as a county for our email, etc. It would have probably been simpler if we hadn't been. We could, some stuff you do and you just pilot it on your own. It's a free account. We tried to go through the approval process, and we found out in the process of that many other people in the health department had created their own workarounds and were doing sort of comparable things without going through an approval process. Part of the challenge was if we were going to use the Multnomah County application, then our IT team, was trying to be thoughtful about how many different applications did they want to support. This is all self-contained. Like you said, people use it in their own home all the time. It's really set up and doesn't need a lot of IT support, but that doesn't stop people from wanting to put it through the work queue and getting the various approvals. I think that having some of the data we've shared then could be presented by folks in other states, other parts of the country to say, here's what Portland found, here's some of the other evidence. Luckily, as the more of a track record of efficiency and cost effectiveness and productivity to the work, also showing that there's a concomitant track record of no breaches of confidentiality, no problems, then you can build on that yourself without having to necessarily do quite as much intensive evaluation as we chose to do.
And there was another question that someone had texted us, and we love the texting. Have you done a cost analysis to see how much money you've saved? We know we're saving money by not using iPhones, but there's a huge savings in field time, in mailing time and waiting. Because I remember when I was at DIS, I would make a phone call, do a mail out, make more phone calls, wait on that mail out before I went to the field. And we've never done a study to see how much we're saving there, but just I know that we're having a huge savings just from the minimal amount of field time we have to do compared to a year ago.
Based on experience, we would call first, then call a few times, then no answer from that particular individual. We'll mail. We will do a mail out, no response, and then we'll be in the field. I don't know, here in Multnomah County, okay, you have to call, reserve for a car from Motor Pool. They charge the program not only by the time, but by the hour that by the hour that we have the car, by having the car, and it's a time and money thing. Many people don't even open their mail every week. So you call someone, they don't answer, they text, they answer you back, you potentially are saving a lot of money.
Mm-hmm. And then there's 3 other questions. Yes, we'll be glad to email the slides if you want them. The procedures, we can give you a draft we've written a couple drafts actually, one for the DIS work and one for CD nurses that are quite helpful in developing your own, and we'll be glad to share those. And then we use the same procedures when someone tests positive for HIV, we typically call the provider and say, hey, we're following up on this. We just want to talk to the client. Is that okay? And we only have like 125 new positives in Multnomah County last year, but the providers never say no because we have a pretty good reputation. We've done a lot of in-services and stuff. But the point being that we use the same texting messages for HIV clients as we do non-HIV clients, and the response rate is about the same. People who are HIV, Edwin just had one last week. He called, didn't answer, text, boom. 10 minutes later, he had a phone call and was talking to the client.
I know that the question there is about, we can say we're calling from Multnomah County, so we're not even saying we're calling from a health department. Multnomah County is a huge, vague, broad agency, and I understand the question here is, as an AIDS service organization, how would you even say where you're calling from if that innately is going to identify you? And I'm not actually sure what I would recommend.
As an AIDS service organization, I would recommend you use that you have clients opt in to receive text messages, because usually you get a referral, so you develop a mechanism so that clients are opting in to receive these texts. Versus us, where these are like cold calling. We've never actually ever spoken to these clients. So I would recommend, if you were an HIV clinic or a service organization, that you make it routine that when you make that initial contact with a client, that you ask them, hey, we'd like to get a hold of you via text. Would you like to opt in for that? And
if that's the case and they're opting in, you might want to do a little modification in who you're calling. For example, when people call here at the Multnomah County HIV clinic, and how they answer the phone is, good morning, health services. Do you know what I mean? So it makes it very broad. Mm-hmm. It's just a suggestion. I don't know if that will work in your where you are, but that's another option.
Okay, I have another one. Were you surprised at all by the figures in terms of age and people responding? Because you mostly you'd expect the younger generations to respond to the texts, but you're also experienced like people 40 years and over having the same rate of responses.
We had some friends at CDC, and they said, Juan, there's no way the younger people are going to be texting you because they're suspicious of the government and blah, 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 and blah, blah, blah. So we were actually surprised that the younger people were texting us. And I'm not surprised about the other texting because, when you go home, if you take a train or a bus to go home today, look around you, and everybody is texting. It's just a culture now. So it's not, if we had tried to do this when texting first came out, I don't think we would have had the success that we're having now. But now it's just a natural part of the communication cycle where people, including myself, as Kim has pointed out, I don't like talking. I'd rather do a quick text to get the point across of what I have to say.
One of the things that I learned at the Text conference in this year, and I was like, I had a cell phone for a while. I was very reluctant to test. I was still living in the Fred Flintstone era in that kind of sense. You know what I mean? And then I went to Tech, and I listened to these talks about communication. Not only health has evolved and technology has evolved, communication has evolved, and communication has evolved nowadays in the 21st century in the world with technology. That's how a lot of people are communicating right now. Online, electronically. We saw, just to get a little, how technology is part of every single part of our living, not only here in America, in the world. Look at 2011. The revolution in Egypt. How did it start? Facebook. Do you know what I mean? Texting is part of our living, 24/7.
Any other questions? And if anyone wants copies of the PowerPoint, I think you guys are going to host them. If you want copies of our procedures, we'll be glad to share them. If you want copies of our texting consent that we use in Multnomah County, the opt-in consent, we'll be glad to share that. Also the Green Book, or the policy that covers that texting consent.
And right, up on sharedactionhd.org, we'll have the presentation as well as the recording of this webinar up later today.
Cool.
Okay. Well, if we don't have any other questions, I'll just go through some closing remarks. I just want to remind everyone that at Shared Action, we have educational materials. We have a variety of technical bulletins and broadsheets on topics like focus groups, evaluation, recruitment and retention, broadsheets on day laborers, HIV disclosure. We have a lot of information on our website, and we encourage you to come and visit and take a look and see what you can learn. Your feedback on these webinars is very important to us. Later today, you'll be invited to the post-webinar survey. It is a very short survey. We just want to get your feedback on how the webinar went and what we can do better. Because ultimately, these webinars are for you guys. We're here to make sure that you get as much as you possibly can out of it. So please complete the post-webinar survey when it's sent out. And just as an idea, some webinar topic feedback that we've gotten through these surveys are on webinars such as prevention for positives, empowering MSM to change behaviors, the superinfection, harm reduction strategies, and we'll start looking into getting these webinars started for you guys in the future. And if you have any other topics that you'd like to see as webinars from us, you can suggest those in the post-webinar survey. And just to close, I'd like to thank you, Multnomah County Health Department, for what you've done and for presenting the webinar today. If you have any questions or comments or would like to request our services from Shared Action, you can email Oscar Marquez, and the information is on the slide right now. Thank you, guys.
Thank you for having us.
All right. Everyone have a good day. Thank you.
Uh,